I welcome Dr. Alan Finkel, Chief Scientist. Dr. Finkel, would you like to make an opening statement?
I do not have an opening statement.
Thank you. I will commence questioning then, Dr. Finkel, and let me declare an interest. As a Victorian Senator, I have a great deal of interest in your work, working with the Victorian Government on our contact tracing system in Victoria. As a start, could you just give us an update on the work that you've done with Victoria to improve the contact tracing system?
Senator, I'll give you a certain amount. I have been working on the periphery, providing some advice, encouragement, experience based on product development to assist the Victorian Department of Health and Human Services in the development of a digital end-to-end system for supporting contact tracing and outbreak management, and that's been going on for a few months. But currently I'm leading a national review, which is not your actual question, into contact tracing and outbreak management across all the states and territories. In terms of the Victorian review, I have to be cautious, of course. I can't go into great detail because I'm going to be submitting a report to National Cabinet in a couple of weeks. But I can say that outside of the context of the review, but in the context of having done some advisory work for the Victorian Department of Health and Human Services, I have seen enormous progress.
Great. Well, that's heartening. Enormous progress is very important to my constituents, I assure you of that. How long has your involvement been with the Victorian system from beginning to end in terms of assisting with that?
Since very early in August.
So a number of months now. What are the key improvements that have been made to the Victorian system from when you first arrived and observed what was happening to what it is today?
So again, without going into absolute specifics, the improvements have been manifest across all of the system. It's the training of the workforce that is doing the work, the processes that they're using, very much a transition from paper-based forms for test or sample collection and transmission of results to a fully digital process, and just efficiencies in every aspect of the system, and you're seeing it in measurable better performance. Really, 3 months ago, I'm not sure that you would have seen any figures about how quickly they could go from what I call beginning to end, which is sample collection, through to notifying close contacts that they have to isolate. The target that I have been referring to is a 48-hour target from that sample collection to notifying close contacts. And again, I can't give you the specifics, but I'm very comfortable with the performance of Victoria against that target.
Good. Because I guess there's a bit of a compact here. The Victorian Government has asked the Victorian people to make a very big sacrifice in that second lockdown. And what I think the Victorian people are entitled to expect in return is that the government is doing its part to correct the errors of that second wave and be ready to get on top of any further outbreaks should they happen. Are you confident, as much as you can be, that necessary work has happened and that Victorians can have confidence?
So outside of the national review that I'm doing, my perspective is from having assisted as an advisor the process of modernisation of the system, and I can say with great confidence that the resources and personnel being applied to that task are significant, really substantial.
Good.
And the focus on improving the end-to-end process so that cases don't get lost in the system, so that everybody gets followed up with minimal confusion as efficiently as possible. I'd say the effort being applied is enormous.
Okay. And I don't know if you can go into this because of your review, so please tell me if you can't. But in your mind, is there a ranking or hierarchy of systems within Australia, within the Federation? Is there a best practice that everyone should be measuring themselves against?
So there is no such ranking, and we haven't decided the exact format of our review, but our focus will be on identifying the best practices that the various jurisdictions have indicated to us, given us effectively a show and tell, and we'll synthesise that most likely into a set of characteristics of good practice. Look, I think I could share with you that overall I'm impressed with the preparation and the quality and the continuous improvement that all the states and territories are applying to managing contact tracing and outbreak management. They're all taking it very, very seriously, even the states that have no cases.
Yeah, indeed.
It's really encouraging to see that even in those circumstances of no community transmission for months, they're still training staff for a surge need, should it happen. They're improving their digitisation or digitalisation of their systems to support them should outbreaks occur and a surge occur. I've never had the privilege, or perhaps the opposite, of looking at any of the systems that are in place in comparable countries such as in Europe or the States in America, but based on what you see in terms of their case numbers, it's hard to have confidence in those systems. I've had a lot of experience over many, many years as a businessman in the manufacture of life sciences equipment. I've had a lot of experience doing product development, and I understand technology and systems fairly well because of that. And using that insight, so not the comparative insight of actual international systems versus ours, but just looking in an absolute sense at what I'm seeing in the states and territories in Australia. I'm actually pleased, proud and rather confident in our ability to cope with managing the transmission down to an extremely low level, including zero.
Yeah. Well, and as you say, it's those states where they haven't had a lot of community transmission recently where it's perhaps most important for their systems to be ready because the risk of complacency in those jurisdictions is much higher.
But the departmental staff and the emergency services, not just the Department of Health, it's the police department and other departments. I am not seeing complacency. In fact, I'm pleasantly surprised to see how conscientiously they're thinking about where things could go awry, how they can optimise their system, and even doing desktop simulations of what the demand would be and where their resources would go should there be a surge in outbreaks. Okay. And we all say, knock on wood, or whatever your favourite expression is, because none of us want to test the systems. No. If we do any testing, it should be simulation testing. But they're thinking about that all the time.
Okay, good. Just a final question from me then. On this comparative issue, because it was a feature of the Victorian Premier's press conference on Monday, he was asked questions about the state of the contact tracing system in Victoria, and he said, and I quote, "They have technology that is the best in the country. Let's not be in any doubt about that. Alan Finkel has made that clear. The system we are moving to is one that will be emulated by others, and you do not get 4,000 tests plus done when you've had significant outbreak," and it goes on and on and on. I mean, is that a fair assessment from Daniel Andrews, that it's the best in the country and that it will be emulated by others?
It's certainly not it's not incorrect. The reason why I phrased it carefully is that we need some more weeks of testing the system because it's all very new, but by design and implementation, it's very impressive.
Okay, well, let's hope the Premier's right. No, Victorians would be very comforted by that. Senator Pratt and then Senator Patrick.